Anemia due to blood loss form one of the major categories in classification of anemia. Blood loss can be acute or chronic. Both of these produce anemia through very different mechanisms. In acute blood loss, the immediate danger is not anemia, but it is reduction in intravascular volume. If the blood loss is massive, patient can develop cardiovascular collapse, shock, or even death. These effects depend mainly on how fast the bleeding occurs. Hematocrit is basically the percentage of RBCs in blood. So, immediately after acute blood loss, hematocrit will be normal because when there is blood loss, whole blood is lost. Means RBC and plasma is equally lost. But if the patient survives, blood volume is rapidly restored by the movement of water from interstitial component into the intravascular component. This causes hemodilution and leads to the fall in hematocrit. Acute blood loss leads to reduction of hemoglobin. This reduces oxygen carrying capacity of the blood, which in turn causes tissue hypoxia. Special stromal cells in the kidney sense this and produce erythropoietin. Erythropoietin stimulates the proliferation of committed erythroid precursors or colony forming unit erythroid. These cells take 5 to 7 days to form mature red blood cells which can be released into circulation. These young red blood cells are larger than normal red blood cells and contain residual RNA which gives them a bluish hue. This allows pathologists like us to detect these young RBCs. These young RBCs are called reticulocytes, and the increase in reticulocytes is called reticulocytosis. So, acute blood loss causes reticulocytosis within 5 to 7 days. If acute blood loss is severe enough to cause reduction of blood pressure, it can stimulate adrenergic hormone release, which increases WBCs. Recovery phase is also accompanied by increase in platelets. So, acute blood loss results in reticulocytosis, leukocytosis, and thrombocytosis. Early on, anemia in acute blood loss is normocytic normochromic. Later, increased size of reticulocytes contribute to a macrocytic picture. Chronic blood loss often occurs due to leakage of blood through the gastrointestinal tract or due to blood loss because of gynecological issues. Here, anemia is caused due to a different mechanism. The problem is not loss of volume but loss of iron. Chronic blood loss induces anemia when the loss of blood is more than the capacity of bone marrow to replenish the lost blood. Over time, iron stores are depleted and iron deficiency anemia develops. Because of this, chronic blood loss is one of the most common causes of iron deficiency anemia. So, to summarize, acute blood loss results in volume loss first, anemia later, while chronic blood loss results in iron loss leading to anemia. In the next video, we'll look at iron deficiency anemia. Think at the cell level.